Jean-Yves Duclos is the president of the Treasury Board, and he joins us this morning. Good morning, Minister.
Good morning, Rosemary, and good morning to everyone listening.
That's very kind of you. You are in your hometown of Quebec City, a city that I also love very much. But you've entered a 10-day lockdown in the past couple of days because there has been exponential growth in that region. Do you think that enough is being done where you are to contain the virus?
Well, you're right, Rosemary. You and I love this city very much, but we are in critical times. We are being faced with a third wave that is extremely difficult, hurtful for workers and restaurants and many small shops. But that's what it means. We are faced with a variant that is of great concern. Lots of people are being infected by the variant. Some of them sent to hospitals and to critical care. So we need to step up our individual actions and meet the challenge.
Yeah, of course, Quebec is not the only place where this is happening. There's a lockdown in effect now in Ontario, parts of British Columbia, Saskatchewan, and as you said, because of the third wave and the variants of concern. There has been criticism, a lot of it from doctors, from medical professionals, that provinces didn't move fast enough and have still not done enough. Do you think that we should be better at managing this pandemic at this point, Minister?
Well, it's not my job, and the Prime Minister has always repeated that, I think, and quite appropriately, to criticize the difficult work of provinces and territories. We know they are working very hard in difficult and uncertain times. What the federal government needs to do is what its responsibilities are, which is to deliver equipment, tests and vaccines as quickly and as efficiently as possible. Yes, we need to be mindful of the advice of public health, and in Quebec, for some time, we thought we would be spared of a third wave, but that was obviously an illusion. And now we need to step up our acts and just be mindful that the next weeks will be very critical.
Yeah, some provinces, as you know, and some premiers have been critical of the vaccine delivery schedule and the ramp up, that it's not going fast enough. What would you say to them in terms of the number of vaccines coming in the weeks ahead?
Well, first, let me be very honest. The first few weeks of February have been difficult for everyone. Production was lacking in Europe, and that put pressure on provinces and territories. This being said, we did meet and significantly exceed the objective of Q1, the first quarter, of 6 million doses. By now, approximately 10 million doses have been delivered to provinces and territories, far more than the 6 million objective. In the next 2 weeks, in fact, there will be approximately another 5 million doses delivered to provinces and territories. So a total of 15 million doses by sometimes in the middle of April. That's a lot of doses, but still vaccination will not be enough to take us away, to avoid the third wave. So however better and good the vaccination ramp up is going, we need to be very focused on the public health advice that each of us must be following.
Well, that's a good point, and you're right to say it, because many medical professionals have said that too. The vaccine is not enough. Public health restrictions must remain. And on a weekend like this, when many people want to get together with their families and there are other holidays coming, and frankly, as you know, Minister, many people are just tired out. They're fed up of this. What would you say to them about having to bear down for another number of weeks like this?
Well, two things. First, let's admit, as you've just said, Rosemary, that we are all tired and exhausted in many different ways, mentally or physically. Our loved ones, our workers, our small businesses have been facing a very difficult time for too many months. But the second thing is that if we want to get over and to end this crisis, again, the next 4 to 6 weeks will be critical. While vaccination ramps up and protects in particular the most vulnerable among us, we each need to do our job. We need to fulfill our own individual responsibility, which is to reduce significantly our contacts with each other. That's a pain, that's something we would like to avoid, but that's something absolutely necessary while we fight the variants.
On Friday, the Centers for Disease Control in the United States said that Americans who are fully vaccinated, so both doses, can travel at low risk within the United States and even internationally. We have yet to receive really any guidelines from public health or the government on travel. When will we start to understand what the recommendations around travel are and how they might change? Do you have a sense of that?
Well, our conversations are ongoing, and certainly with our neighbor and ally, the United States. This being said, it's not the time to travel now, and it's not the time to consider opening up our borders with any country, including the United States. Even in the United States, where vaccination is more advanced, even there, we're currently speaking of a fourth wave. So that tells us that the vaccination is not enough. Now they are unfortunately playing down in some places in the United States the importance of following public health advice. That is sending thousands of people to emergency care, some of them dying. So we don't want to do that in Canada. We need to be strong and stronger as we face the next critical weeks.
The Prime Minister said again this week that, you know, he's there to offer support, economic support to provinces and to Canadians through this third wave. I wonder if there is a discussion already about potentially extending EI benefits beyond what are there, extending the wage subsidy, extending any of those programs, because we are in a third wave and this is going on perhaps longer than we thought.
Well, that's an excellent question. And the Prime Minister, the Minister Freeland, the Minister of Finance have always said, and I'm there to support that again, that we will be there for as long as it takes and for how much as it takes. Obviously, we are facing a third wave, which was both unexpected and certainly not the outcome we were hoping for at this time of the year. So I think we all look forward to seeing the budget on the 19th of April. But the budget will do what I've just said, and Minister Freeland and Prime Minister Trudeau have said, that is, we will be there for Canadians for how long it takes to exit out of this health crisis and therefore exit out of the economic crisis.
I'm glad you brought up the budget, because that lets me get one more question in on the budget, and I'll have you put on your Treasury Board hat for that part. The Parliamentary Budget Officer said last week that the economy is actually doing a little better than we expected. The deficit's still going to be very, very big, more than $300 billion, but that after the crisis is over, the federal finances are going to be sustainable in the long run. I wonder if that begs the question then, Minister, about whether the stimulus package that Minister Freeland has talked about between $70 and $100 billion needs to be that big. Is there any thought about whether that much needs to be spent, given that the economy is perhaps going to recover better on its own than we expected?
Very good. Well, first, it's obviously to Minister Freeland that the answer will come from. But second, if I may answer from an economist perspective, one of the lessons that we've learned from previous recessions and depressions is that there has been a tendency for governments to underinvest as we exit of an economic crisis. That is a very unfortunate outcome, because it means that we are then faced with higher unemployment, lower growth, lower living standards for Canadians, and therefore lower taxes and greater deficits over the longer term. So there is, unfortunately, as for the health crisis, a tendency to underreact, to be underprepared, and to be underreactive, as I just said, to the challenges posed either by the health or the economic crisis. So it's better to invest more and to exit of the crisis faster and stronger than to underinvest and then to be faced with a lower level of growth, a higher level of unemployment, and therefore more challenges in terms of the fiscal framework.
Okay, Minister, I'll leave it there. We covered a lot of ground. Appreciate it very much, sir.
Thank you very much, and have a great day.